Good evening, and thank you for joining us tonight for Progression Planning, Managing the Common Challenges of Progressive MS. This webinar series is brought to you by Can Do Multiple Sclerosis, the National Multiple Sclerosis Society, and the Multiple Sclerosis Society of Canada. My name is Laura Allen. I am the Programs Manager for Can Do MS, and I will be your moderator this evening. Can Do MS delivers health and wellness education programs to help families with MS thrive. Please visit the Can Do MS website, cando-ms.org, to learn more about Can Do MS's online and nationwide in-person programs. The mission of the National MS Society is to help people affected by MS live their best lives as they stop MS in its tracks, restore what has been lost, and end MS forever. You can explore other societies' programs, services, resource, and connection opportunities at nationalmssociety.org. Our speakers this evening are Mandy Rohrig and Megan Weigel. Mandy is a member of the American Physical Therapy Association and currently works in an outpatient physical therapy setting where she specializes in the rehabilitation of individuals with neurological conditions with a special emphasis in the treatment of individuals with MS, as well as balance and vestibular disorders. She is actively involved in the MS community in Omaha, regularly consulting and presenting among local MS exercise and support groups. She is also a senior programs consultant with Can Do MS. Megan is a nurse practitioner and has been practicing neurology for about 20 years, most of which has been focused on MS. She recently completed a fellowship in integrative medication at the University of Arizona and has launched her own practice, First Coast Integrative Medicine. And now I would like to turn the meeting over to Megan.
Thanks, Laura. Today we're going to talk about some things that are sometimes hard for people to even grasp in their minds. And also we're going to try to give you strategies to make them a lot easier so that you think about these things before they happen and you have some planning in place. And hopefully it will provide you with a little bit less anxiety about what might happen when you live with MS. So we want to give you solutions and strategies that give you a good approach to the challenges of living with progressive MS. Our objectives tonight are to clarify the differences between relapsing remitting, primary and secondary progressive MS, to problem solve strategies and solutions to manage the common challenges that are involved with disease progression, and then to understand and apply the Can Do MS 5 Ps for managing progression. And by the end of the webinar tonight, you will definitely be well versed in what the 5 Ps are. And I think you'll find them easy to implement into your lives for many different challenges. We just want to really clarify the classifications of MS, because things have changed a little bit in the past, say, 3 or 4 years when it comes to how we talk about the types of disease. Relapsing MS is still the most common type. It's characterized by flares or exacerbations or relapses, and these are caused by inflammation in the central nervous system. They may improve with time and sometimes more quickly with steroids, but eventually some residual disability may remain after a relapse. Progressive MS is thought to be more of a degenerative disease process that damages neurons and axons in the central nervous system and causes a slow and chronic decline in the ability to function even without relapses. Secondary progressive MS occurs in about 50% of those living with relapsing MS within about 15 to 20 years of diagnosis or of symptom onset. In this phase, there's gradual worsening of existing neurological signs and symptoms, even if you're not having relapses. Secondary progressive MS is part of the new MS phenotype classification that was defined in 2013. And if a person with secondary progressive MS is still having relapses in spite of continued disability progression, then certain disease-modifying therapies may be helpful. Primary progressive MS has very specific criteria. It includes a year of disability progression from the onset of presentation with specific MRI findings and or findings in the central CSF, in the cerebrospinal fluid. In 2017, the first medication for primary progressive MS called ocrelizumab was approved to slow the effects of primary progressive MS. In clinical trials, this medication showed a 25% slowing of progression, but it was not shown to improve function. So it was not shown to improve, but rather slow down disability progression. Still a plus because it's the first and only therapy that we have for primary progressive MS for disease modification. This is a really great chart that explains what used to be in the classification of progressive disease and how we talk about it now. And I'm going to focus mostly on how we talk about it now, which is the right-hand side of the column. We talk about progressive disease as either primary progressive or secondary progressive, and either active or non-active, and with progression or without progression. And when we're talking about activity, we're talking about relapses, MRI changes. And when we're talking about progression, we're talking about slow changes in disability or symptomatology. So a person can have active disease without progression. And that might look like you get an MRI and there's a new white spot on the MRI, but you haven't noticed any changes in your body. A person can have not active disease, but with progression. So you haven't had relapses, there haven't been MRI changes noted, but yet you still notice a slow decline in your ability levels, either with mobility or with cognition. So these things are also dynamic, which means that recommended evaluation time points are usually 6 to 12 months. And within 6 months, you may be active without progression. And then in the following 6 months, you may have disease activity or you may have some progression. So these things can be in flux, even in the progressive phase of either secondary progressive or primary progressive MS. So you might say, well, what is progression? And these are the questions that we ask you to ask yourself. So over a longer period of time, that period being several months, not a few days or a couple of weeks, but over a longer period of time, have you had any progression in the following symptoms? Cognition, or the way you think, sensation, the way you feel, walking, visual function, fatigue, neuropathic pain, bladder or bowel function, or balance and coordination. And I would encourage you guys to not just ask this question of yourselves, but also to ask it of your support partners, your loved ones, your friends, your coworkers, because they may notice subtle things that either you don't want to notice or that you just don't notice. So when we're focusing on treating progressive MS, we're looking at health and wellness strategies, disease management, and symptom management. And if you can take away a good piece of information from all of these pieces of the pie tonight, I think you'll be in a really good place to be armed with information. Mandy?
Thanks, Megan. Megan's done a wonderful job of kind of outlining the basics of progressive MS. So what we want to think about now is, what can we do today? What can we do right now? And that's where the 5 Ps come in, the 5 can-do MS Ps, controlling what you can control right now and taking charge of your disease progression. The 5 Ps of progression are being proactive, planning, prioritizing, problem solving, and identifying those professionals who can help. So we will put into action to illustrate how the 5 Ps work, but a general description of each of these I'll briefly go through. So the first is being proactive. So it's anticipating changes, anticipating progression and making decisions now that set you up for success in the future, set you up for success for things that you may or may not need. So for example, if you have difficulty advancing your leg or you have drop foot now, it may not be a great idea to go buy a vehicle that has a stick shift or requires a stick shift or a clutch to drive. So thinking about those changes or those decisions that you make today and how they may impact your future. Planning. It's always important to plan for unpredictability. So if you have a plan in place or you've talked through some of these challenges or some of these potential scenarios, that can make approaching or being confronted with those challenges, if and when they are in your future or in your present, it can reduce that anxiety. It can give you a sense of security because you've already problem solved and you've already kind of thought about what your options might be. Prioritizing is giving yourself realistic expectations. Perhaps before progression or progressive MS, you were able to work a full-time job, volunteer in the community, take care of the home, and now it's become more difficult. So it's really, hopefully, focusing your lens a little bit more on what you want to do, what's most meaningful to you, what's necessary for you, and learning to ask for help or adapt in those situations where you may need to. The next P is problem solving. So with this, we encourage you to problem solve the current disease and progression challenges that you might have by a menu of options that address that unpredictability. So your symptoms of MS can fluctuate hour to hour, day to day, and certainly from year to year. So being open to the options that can help you most successfully and optimally manage those challenges is what the problem-solving P is. And the last but certainly not least are who are the professionals who can help. Often with increased disease progression, people experience an increased need for accessing the healthcare team. So identifying those professionals who can help with what challenges you're experiencing and monitoring those challenges and changes and intervening with those professionals is the last of the P's. So now what we're going to do is we're just going to go through a few scenarios to help illustrate how you can apply the 5 P's to some of your common progressive challenges that people are confronted with. So this first one is, I keep missing deadlines at work. I'm forgetting appointments. I just can't seem to keep my work organized. So this person is really struggling with cognitive issues. Megan, can you tell us a little bit about what we can do there? Excuse me, I clicked the wrong one. Thanks.
Thanks, Maggie. Absolutely. So cognitive changes are really common in MS, estimated to affect more than 50 to 60% of people. And the problem with cognitive changes is that you can't necessarily see them. So in fact, you may not even necessarily have coworkers or family members commenting on the cognitive changes, but you know that they're happening because you know how your mind used to work. They can be related to MS symptoms, but they can also be related to other problems like sleep that's not restorative, significant anxiety or depression, pain, and even medication. So if you've started a new medication that could potentially be sedating or cause other physical effects that might have effects on your mind like dizziness, those are things that need to be considered. In MS, cognitive changes, those related specifically to MS, can impact your memory, so your working memory, your short-term memory, your ability to recall things, your attention and concentration, your speed of thought, and also complex problem solving. And so people with MS in the workforce may say, everyone's always updating their systems, right, on the computer, and they say, gosh, it takes me longer to learn this than it used to. I had to have someone help me, or I had to review the information several times. And it can be difficult to prove or convince people that you have cognitive impairment. There's also a very real symptom that goes along with MS fatigue, that's cognitive fatigue. So just as your body might get totally zapped, you know, like that plug was pulled on an old-fashioned TV, I like to think of, the same thing can happen with your mind when you're fatigued, or even when you're hot. I think a lot about heat these days because I live in Florida. So it's one of the leading reasons why people leave the workforce over even physical mobility challenges. I would encourage people to definitely discuss this with their healthcare providers as soon as they begin to worry about it. You tell us a little more about that, Mandy?
Yeah, Megan did a lovely job of just telling us that the first of our P's is being proactive. It's talking to your MS provider, talking to people like Megan as soon as you notice the changes so that they can address them, refer you to the professionals who can help. Secondly, I also think it's important, given the fact that cognition can affect employment, as Megan just described to us, it's never too soon to get a good understanding of the ADA and what your rights are, or the Americans with Disabilities Act. It just prohibits discrimination against people with physical or cognitive challenges. And there are 5 different sections of it, but the first section is what applies to employment. And it just says that if you work for an employer with 15 or more employees, they're required to make reasonable accommodations to allow you to continue your work. So that's something to keep in the back of your mind if you are struggling at work, and to certainly talk to your healthcare provider about that. So that's the proactive piece. The plan piece, we want to be planning for cognitive challenges both every day and figuring out ways to tackle them every day, but also for the future. So considering alternative work arrangements, in the immediate time, you may want to consider a flexible schedule, maybe working from home or working different hours if that allows you to work around some of your MS-related symptoms. And maybe it's worthy of a conversation with an organization called Vocational Rehabilitation. I believe in different states it's called different, it has a different title. But essentially what it is it's a state-run organization whose sole purpose is to keep people working. They want to keep people employed. So they can help finance some of the accommodations and adaptations that allow you to do so. Personally, I've had a client who was able to get a van adapted that allowed her to continue traveling to work to do her job. Vocational rehab helped her to finance that. So Voc Rehab can not only help you keep doing the job that you're doing now, but they may also provide you some alternatives for other occupations that are suitable to your abilities. And then when you think about planning for the future, you also want to think about alternative work also. If you're someone who works construction, but the fatigue and the heat, the summer heat is becoming difficult, then you may want to look at other job options. And again, vocational rehab may be someone who can help. Financial planners, when you're talking about planning for the future, and I bring this up because often the financial planners that you find in the yellow pages or in the phone book are actually wealth planners, and they can be helpful, but often folks with MS don't need wealth planners as much as they need someone to help them anticipate the financial challenges related to living with a chronic illness. So what I would encourage you instead was to maybe contact the National MS Society, 1-800-FIGHT-MS, and what they can do is put you in contact with a financial planner. They offer free financial planning services that allow you to start anticipating some of those changes in your employment if and when they may happen. The next one is FMLA, and I suspect many of you are familiar with this, but Family Medical Leave Act. It just allows you to take up to 12 weeks of unpaid leave, so that you're able to return to your work after a period of a health challenge. The next one is disability, and insurance are kind of tied together, but to think about these both now, again, anticipating and planning for planning for progressive challenges. When you think about disability, think about short-term disability, think about long-term disability, and even think about the potential of maybe even needing Social Security disability if that's in your future as well. So understanding your options and starting to arm yourself with the information that can help you make those decisions if and when the time comes. And lastly, but certainly not least, is insurance. And just be cognizant that if your health insurance is tied to your employment, that can affect your ability to access your health care. So just being cognizant of the impact of any type of job or employment changes could have on your MS management. So we've talked about proactive management of cognitive challenges, planning. The next one is prioritizing. So the National MS Society recommends baseline cognitive screening, both at diagnosis but then annually after that. If there would happen to be any cognitive challenges that would be identified during that screening, it's not uncommon for the healthcare provider to refer for neuropsych testing, which would just be a little bit more in-depth testing. But in the meantime, you can always just think about simply making things easier and simplifying your life with a variety of rehabilitation strategies. So that takes us a little bit into the problem solving, P, which is your cognitive rehabilitation. And cognitive rehabilitation can involve both remediation strategies and compensatory strategies. So what I think is important to note is that there's research going on right now about MS-specific remediation strategies. And the emerging evidence is suggesting that just simply keeping your mind busy, so reading and doing puzzles and staying cognitively active and intellectually stimulated can be helpful. Right now, there is no evidence to suggest that some of those brain games and those some types of word games are actually helpful for some of the challenges related to MS, but we'll see. Research will tell us more. And lastly, but certainly not least, the professionals who can help with cognitive challenges. Certainly our mental health professionals, speech-language pathologists, occupational therapists, and then our voc rehab folks who we've touched on already. So now that we've talked about the can-do, to-do for cognitive challenges related to employment, let's move on to another challenge. Now that my disease has progressed, I have so many doctor's appointments. This disease is my full-time job, and I am so anxious. Megan, can you tell us a little bit about mood changes related to progression?
Yeah, Mandy, thanks. You've done a great job with cognition, and sometimes these things go hand in hand, right? Because as we start to notice changes in ourselves, often they can bring up some anxiety or depression about what's to come next. Depression is truly one of the most common and treatable symptoms of MS. It can result from brain changes, so literal lesions in the part of your brain that are associated with mood. With life changes, like I said, just changes in roles, changes in your level of independence or dependence, and worries about the future. And it can even happen from medication side effects, as well as from other medical conditions. So thyroid disease, particularly hypothyroidism, can cause depression. Hyperthyroidism can cause symptoms suggestive of anxiety. Vitamin B deficiencies, magnesium deficiencies, so even anemias can cause anxiety. So these are important things that your healthcare provider will work through with you in order to find the right treatment for you. Depression is characterized by low mood, by loss of interest in things that used to make you happy, suicidal or morbid thoughts, and those can be subtle. So it doesn't necessarily have to be that you're thinking about death, but it may be that you start to become overwhelmed in your thoughts by where should the things in your house go when you're not here? Like maybe you start making lists about what you need to get rid of, not because you're simplifying, but because you're thinking in a more morbid sense. Changes in appetite, and that might be your appetite goes up, might be your appetite goes down. Sleep pattern changes, and again, that could be you're sleeping a lot or you're not sleeping as well as you used to. Difficulty with thinking and memory, and feelings of hopelessness, and even increased irritability. So depression doesn't always manifest as someone who's crying all the time. There can be a lot of other symptoms that occur that suggest mood changes. Depression and anxiety can occur together, and they can be experienced not only by the person who lives with MS, but also by the support partner who has his or her or their own challenges in accepting the progression of the disease and the things that are changing with daily routine or lifestyle, and the overall amount of care that may or may not be required. So these are things that should be addressed on both sides of the coin by both the person living with MS and the support team, I'll call it. So what is our can do to do for mood changes? I have a little technical slowing here. Okay, so sorry about that. So our can do to do is to be proactive. You can get regular screening. So to be proactive, you should have regular screening for depression and anxiety. And in fact, these regular screenings are as quick as 2 questions in your doctor's office. And one of the healthcare providers that you're seeing is probably screening you for depression without you even knowing it. So just simple questions like, have you lost interest in any activities in the past few weeks that have lasted for a couple of weeks period of time? You may not even notice that they're screening you for depression. But to be proactive, I think one of the things that you can do is make a list of the things that bring you joy and refer to them frequently. Even making a gratitude list or keeping a gratitude journal and writing down 3 things every night before you go to bed that you are grateful for today can have a tremendous impact on your mental health. And it's actually a prescription that I will sometimes write for people to start doing. To plan for mood changes like depression or anxiety, it's important that you not hide your symptoms and that you talk to your support team. If you have insurance, and even if you don't, I would say that it's very important to investigate your mental health benefits. So if you are uninsured, oftentimes mental health professionals will see you by paying out of pocket. There are many mental health professionals that actually don't accept insurance anymore just because the reimbursement is not good enough for them to stay in business, unfortunately. So what is good about having insurance is, depending on the size of the company you work for, you may have something called an EAP, which is a program that allows you to access mental health care from counselors, social workers, psychologists at a much discounted rate. And if you don't have that, then again, looking in to see what your benefits do cover and finding a good counselor to talk to is really important. Prioritizing your mental health really at the top of the tier of your list of symptoms that are important can make major changes in your life in a good way. So mood changes deserve the same day because you just don't have the motivation to get up, then over time you could lose some of your physical abilities because you're just not using your body, which increases your risk for a lot of other things like having a sedentary lifestyle, putting on weight, losing connections with community, maintaining friendships and relationships with family. And all of these things are just so very important for your own healing and wellness. So making your mental health a priority is really a priority. And there's that old adage that you should put on your own oxygen mask first, right? So if you are living with MS and you're a support partner for someone else, say elderly parents with dementia, or if you are a support partner of a person living with MS, always be sure that self-care is a priority for you, and that includes addressing mental health changes. Problem solving with depression and anxiety can include things like talk therapy with a counselor, psychologist, and also medications. And the research tells us that doing the both together is better than doing either one alone. And so, if you have depression or anxiety and you're prescribed a medication, but you lack the coping skills to know what to do when your mood starts to improve, then you can see that the next time you're hit with some additional symptoms or increased symptoms of depression or anxiety, what are you going to do about it? And that's where the talk therapy comes into play, because it allows you to create coping mechanisms for life. I personally think everyone should have talk therapy at some point. The professionals that you can talk to about mood include nurse practitioners, nurses, neurologists, mental health professionals, even clergy. And I have to add here that rehab specialists like your PT, your OT, your speech therapist are often the people you're spending the most amount of time with. So if you're in PT or OT, you've got hour-long visits twice a week, and I can't count on my two hands how many times a physical therapist has called me and said, "Hey, I'm really worried about Mary. She said so-and-so at her visits." So I think it's just a really great resource to have this team of healthcare professionals around you who you feel comfortable and safe with talking about mental health problems, so that we can all communicate with one another and get you off on the right foot. Mandy, could you talk to us about the next scenario?
Yes, and thanks, Megan. That was great. This next vignette is: my wife can no longer walk more than a minute with her walker. I come home to her laying on the floor as she is falling daily. We feel trapped in our home. This isn't an unfamiliar scenario that we hear in rehab at times. So let's talk through this related to progression. Go ahead and next slide, please. So transitioning to use of wheeled mobility, it's pretty challenging. It's pretty terrifying for a lot of people. People often feel like suddenly the disease is winning, right? And if they decide to use something more than that cane or that walker that they're using, then they're giving in. And there's all of this self-doubt and this blame, like I should have done more, I should have done this, I should have done that. I'm having to use this wheelchair now because of something I did. But as illustrated with this couple, not considering mobility aids has pretty significant consequences, right? And the consequence for this couple is experiencing falls, fear, and isolation. And it's not uncommon to either avoid using an assisted device or avoid using the next progressive device. So in other words, transitioning from a cane to a walker, say, or from a walker to a wheelchair. And unfortunately, that hesitation can result in dangerous falls and lead to other medical problems. And it's this cycle that we see often in rehabilitation, and we hear with our folks with progression, is that they have a fall, or they're at increased risk for fall. That results in reduced mobility or hesitation to move because of their body feels so unfamiliar, and they're trying to figure out how to make that different. So they're falling, they have that reduced mobility that results in more deconditioning. And when deconditioning happens, then you start to experience worsening MS symptoms, and all of that kind of together creates this situation of isolation, which can have negative and adverse effects on quality of life. So it's really important to prioritize safety in this situation. And I think it's important to note that just because you have one mobility aid doesn't mean you can't have a variety of them. The example that we give is you may choose to use a scooter or wheelchair earlier in the day so that you can have the energy for later in the day and use the walker at night. So it doesn't have to be this all or none mentality. It's good to have different options for different environments, and those rehab professionals, as well as other members of the healthcare team, can kind of help you investigate and problem solve which devices can help you at which time. You know, we have our beloved neurologist on our Can Do MS team, and many of you may have heard him before. His name is Randy Shapiro, and he always says that the key to overcoming disability is mobility. The key to overcoming disability is mobility. And I really think he's right about that. It's figuring out different ways to keep people moving and keep people enjoying their life and avoiding that isolation. Next slide. So what are the can-do to-dos for transitioning from walking to a wheelchair, transitioning with mobility aids? Number one is to be proactive. Think about how your mobility needs change on an average day. We know symptoms fluctuate from hour to hour, day to day. Identify what mobility tools can be helpful in each of those situations, and then make a plan. Maybe it's something as simple as trying out the scooter at the grocery store. And, you know, ask your rehab professionals, ask your durable medical equipment providers. Sometimes they are very willing to provide you a mobility aid that you're thinking about or considering for a day or two, just as kind of a loaner. So think about asking those folks as well. The next P is planning. Bringing up mobility at your MS appointment with your nurse practitioner or your neurologist, because those mobility evaluations often require their own visit. And I'm actually going to let Megan jump in and tell us a little bit about the necessity of having your own visit for those mobility appointments.
Yeah, so, you know, this is really, actually a Medicare requirement. Mm-hmm. So Medicare requires that for any mobility device, so not just a power mobility device, but for a walker, a manual wheelchair, a person have a visit that's specifically for that mobility evaluation. And, you know, I'm actually not sure why this occurs, because in my opinion, it certainly is an inconvenience for people who are traveling sometimes far distances or dealing with fatigue to get back to the doctor. And very often a provider can make a visit be a mobility visit if it's convenient for a person. But certain elements have to be addressed, and those elements include safety, like you already mentioned, Mandy. Like, is a person safe and capable of using a certain assistive device? What have they tried in the past, and why can they no longer use that thing? Is it because of balance or weakness or sensory loss? And specifically as it relates to power mobility devices, how is their home set up, and for what mobility related activities of daily living would they need that device? And so for Medicare, that's required, and I think it's just sort of translated over to most insurance companies follow the same rules as Medicare. So if you have an appointment coming up with your neurologist or your MSPA or nurse practitioner, call them and have, hey, do I need to make an extra appointment for this, or can we address this at the visit, because the visits are often a lot longer. So that's a good question for asking it.
Thanks, Megan. So clearly the rehab professionals need that input from the neurologists or nurse practitioners, because then we use that information as well as the information we gather from our visits to make a recommendation on the most appropriate device. We do not want all of you wasting your valuable money or insurance resources on a device that's not helping you optimize your mobility and helping you hedge your bets for future progression. So I like this advice. Don't purchase any device other than a cane without the assistance of a rehab professional. I really think that's important given those restrictions. And usually it's every 5 years for wheeled mobility, and then every couple years for other assistive devices. The next P is prioritizing, and this is pretty intuitive. We always prioritize safety first. The implications of unsafe mobility for you and your loved one is just simply too great. Too often in the clinic, we see someone have a fall, and then they have a terrible fracture and hospitalization, and they're set back pretty significantly, and it becomes even more difficult to return to that previous level of function if possible at all. So avoiding falls altogether and prioritizing safety is critical. So to reemphasize again, those adaptations, those accommodations, improve safety and improves overall quality of life. If you feel like the mobility aid that's recommended for you or that you're considering isn't helping you expand your world safely or helping you avoid isolation safely, then it's probably not the right device for you, and something else needs to be considered. So this is a nice lead into the next P, the problem solving. Again, consider a menu of options of adaptive equipment, but also a menu of options for exercise. When your mobility changes or there's a transition from walking to wheeled mobility, people are often really concerned that whatever strength that they do have in their legs is going to be completely gone if they use a wheelchair rather than doing the walking. So it becomes even more important, and that's a legitimate concern, right? So it becomes even more important for people with MS to get in contact with the PT to give you the proper exercise program to help you optimize your leg function to the best that you can while still safely using that mobility device. And it may come as no surprise, the last P for the professionals who can help are your rehab team, your PT, your OT, your neurologist, your nurse practitioner. And the one on that list that you may not recognize, some of you, would be the physiatrist. The physiatrist is a physician who specializes in movement, so they may also be pulled into the picture when you're starting to talk about different devices and different mobility aids that could help you. So let's go to the next slide, and we'll introduce this vignette. I'll go ahead and introduce this one. It's "My disease is getting worse despite my efforts." Very common. People are working hard. You're trying the best you can. You feel hopeless. I feel hopeless. I feel desperate. I think I'm going to go to another country and get stem cells. I want to try something extreme. I want to try something different. Megan, can you tell us a little bit about that?
Thanks, Mandy. And you know, that sentence sounds a little bit dramatic, but it's actually not. I can't tell you how many times I've heard that in my clinic. And you know, when we get to the progressive phase of disease, because it's something that traditionally we have not had great treatments for, we start to grasp at straws and we want to hang on to anything so that we don't have to worry more or think about when actually that bad thing we've always imagined is going to happen. But it's important to hone in on the science with what we know about progressive disease. So specifically, let's talk about stem cells. The National MS Society has wonderful patient information about stem cell research and also community-based stem cell clinics. And research to date suggests that the people most likely to benefit from stem cell therapies are actually younger patients, so younger than 50 years, having had MS for less than 5 years, and who have active relapsing remitting MS but are still walking. Nonetheless, their disease isn't adequately treated by what we have available in our disease-modifying therapy armamentarium. So this certainly does not look like a progressive cohort of people. And it's not because the progressive cohort of people hasn't been studied. So there actually have been older people in these clinical trials who've had MS for decades, who are not actively relapsing, and they haven't had as good outcomes and also have had more adverse events in the clinical trials. Now, there are ongoing trials in progressive forms of MS, particularly with mesenchymal stem cells. And the for-profit stem cell clinics that you can find really anywhere these days, they charge anywhere from $5,000 to $7,000 to $30,000 per treatment, depending on whether or not your stem cells are given IV or intrathecally, which means in your spinal fluid, almost like if you were having a lumbar puncture. And then they also give you other things like IV vitamins, sometimes hyperbaric therapies. In any case, these clinics aren't regulated, and they really should be approached with caution. This isn't the same type of stem cell therapy that's been studied in clinical trials. So there's not myeloablative therapy given, which means you're given chemotherapy, so that when you are given stem cells, your body doesn't attack them. And I think that, there's a lot of information available on the internet with blogging and with YouTube videos, and it's really easy to hold on to that N of one, or that one person who's had a miraculous event. And when you're looking for a miracle, that's what you hold on to. I believe in miracles, but I also believe in science. And I know for sure that people living with MS who have gone to some of these stem cell clinics have had improvement in their symptoms for a period of time, and some haven't. Some have had adverse events and some haven't. But whatever you do, please discuss it with your MS provider before you choose to spend that kind of money on a type of treatment that hasn't been clinically proven. That being said, because of the amount of research that's ongoing with stem cells, you can also talk to your MS provider about whether or not there's a clinical trial that you might enroll in. And so, those are certainly options. The other thing that we get asked a lot about is cannabis. And it's not necessarily medical marijuana. It's more like the CBD oil that your neighbor is selling, or the CBD oil at the local health food store. And so we have absolutely no evidence right now that the endocannabinoid system is altering or modifying MS as a disease. We do have some low-level evidence that oral cannabis extracts and a couple preparations that have been pharmaceutically driven, like Sativex and Epidiolex. Epidiolex is specific to epilepsy, but Sativex can be helpful for spasticity. The oral cannabis extracts can be helpful for bladder dysfunction. And also for neuropathic pain. So we do know that sometimes these things, sometimes specifically the oral cannabis extract, which is not CBD oil, can be helpful for these symptoms. You need to be really cautious with CBD oil because it's not regulated. Neither is medical marijuana. I mean, you don't know what you're getting from, one trip to the pot shop to the next. But CBD oil is not regulated, and even though it's not supposed to have THC. Other thing that I'll say is that the studies that have been done with any type of cannabis that's smoked in MS show that there's definite impairment in cognition. So if you're using medical marijuana and you're smoking it in a marijuana cigarette for your spasticity, then it's going to come at the expense of your cognition, which in my opinion, you wouldn't want to, do that. So these two things are the things that come up the most And I think that if you're thinking about doing either one of them, it's really important to talk to your healthcare provider about it, because you just don't want to make a rash decision about these things. Now, the good news about progressive MS is that there are lifestyle changes that can be made that can have an effect on the disease, and at least on your symptoms, if nothing else. I will say that a study with a higher intake of monounsaturated fatty acids, which are that's the MUFA abbreviation there, which are things like olive oil, avocado, walnuts. Higher intake of these things in the diet are associated with increased cortical thickness in a small study, which means a bigger brain or less brain atrophy. Small studies do show improvement in fatigue, a sense of well-being, when you're using a higher quality diet of any type. So that basically means, good quality fruits and vegetables, low in processed foods, or the WALS protocol, or a Mediterranean type diet. So I don't think there's a one size fits all diet for every person who lives with MS, but when you're eating a higher quality diet that is plant-based and non-processed and low in sugar and high in color, and plant-based doesn't mean no meat, by the way, it just means that most of your plate is vegetables, then you can expect to have an improvement in your symptoms, particularly if you're taking out junk food, right? Because junk food's not good for you. It doesn't do anything for your body. It doesn't fuel your body, not just your brain, but your heart, your muscles, everything. No large-scale study shows that a certain diet modifies the disease, but lots of studies do conclude that plant-based diets improve overall health. So the same diets that that I just mentioned are also beneficial for high blood pressure, for insulin resistance, for high cholesterol, for weight loss, even for mood. In progressive disease, as we talked about earlier in the conversation, ocrelizumab has been approved for primary progressive MS. There are disease-modifying therapies for relapsing forms of MS, and as of this year, in fact, just in the past few months, we have 2 disease-modifying therapies that have been approved for active forms of secondary progressive MS, which is huge. So we now have treatments available for both of our progressive populations, and that's a huge win for me. And I think for people who've been taking care of people for MS for longer than I have, it's even a bigger win. So let's just move on to our can do to do for the progressive disease from a medical standpoint is to be proactive. So do your research on claims. And if you can't easily find scientific evidence, it probably is because there isn't any. So if you hear about something like even, an infomercial on TV that says this or that is going to help your brain, and you go to the website and it's just that John says this and Mary says that and the chiropractor says this and the vet says this, and you can't find a study, just go ahead and close that browser window. Also plan. So have a discussion with your MS provider about your why for a certain type of therapy, and consider their opinion as well. So some people might even say, I'm not sure that I want to take one of these therapies because of the adverse events. And so engage your loved ones and your healthcare team in a lively debate about both sides of the coin. Ask for resources, and try to make the best decision with the information that you have. It's important to prioritize your life goals, your finances, and your willingness for adverse events when you're talking about treatment of progressive disease. And that includes financial loss. And what I mean by financial loss is, let's say that you decide to engage in one of the stem cell therapies at a community clinic, and you take money out of your 401k that you have to pay taxes on, and you go to the clinic and you have a safe experience, but you don't have any benefit in your symptoms. You have to be willing to accept that financial loss. Now, the flip side of the coin, if we're having a lively debate, is I've had a dear friend who has MS say to me, I couldn't not take the chance financially. And so those are the the pros and cons lists that you need to make with yourself, with your loved ones and your healthcare team. Problem solve. So what might be a better choice? So instead of spending $300 a month on a supplement that claims to make you think better, might it be better to try to de-junk your diet for 2 months? Would certainly be cheaper. And then professionals you can turn to for choices are your neurologist, NPs, PAs, your primary care doctor, even nutritionists and exercise specialists, your rehab professionals. I think we can just leave the same people on the slides.
Great. Well, I'll start with the next vignette then. Actually, this is the final one. Since I cannot exercise as much as I have in the past, I've gained weight. Now I have developed diabetes and sleep apnea along with this MS mess. This is a common combination of challenges that I often hear in rehab. Next slide. So Megan, can you tell us a little bit about comorbid health conditions as they relate to MS? What do we know about that?
Yeah, absolutely. And I think this is a great place for you guys living with MS to really grab the bull by the horns and be empowered by health. And I like to talk about, your well care, your health care instead of disease, because there is so much you can do about these other comorbid health conditions. So first, let me tell you what a vascular comorbidity is. A vascular comorbidity is diabetes, or high cholesterol, or high blood pressure, or cardiovascular disease, such that you've had a heart attack, or you have coronary artery disease, or congestive heart failure, peripheral arterial disease, or a stroke. And having just one of those increases the likelihood of reaching EDSS of 6 by 6 years. And an EDSS of 6 basically means you're using mobility assistance all the time. Other medical conditions can cause symptoms similar to MS. So thyroid disorders, anemias, vitamin deficiencies, things I've mentioned already, sleep disorders and mood disorders can either make your MS symptoms worse or can make you wonder if MS is, rearing its ugly head again. And it's just very important to maintain control of your general health. And this usually means that you are, seeing a primary care provider regularly, seeing your neurologist regularly. We'll talk more about that in the can do, to do slide. But what I meant by using these things to empower yourself is that we just talked about things that can improve your sense of well-being and your symptoms when you're living with MS, things like following a healthy diet, things like exercise. And so if you can also use these things to prevent or to improve these other medical conditions, then you're setting yourself up for a better life with MS.
And you said it beautifully, Megan. I think we do need to grab the bull by the horn. This is something that we can do tomorrow. This is something that people can do in the moment and start to make good positive changes to affect their comorbid health conditions, either prevent them or impact them positively with changes to diet, exercise, and lifestyle. And again, those in turn have an effect on the MS symptoms. So that's very proactive. It's very forward thinking and something you can do today. As far as a plan, the P part of the plan, we can make regular appointments with our primary care provider. I would strongly encourage you, if you don't have a primary care provider, to get a primary care provider. If you want to make sure that the screenings that you need to have done for your age, you can actually go on the CDC's website, cdc.gov, and search for a prevention checklist, and you can enter your age as well as your gender, and it'll pull up a list of screening procedures that you're supposed to have for your age. So for example, blood pressure checks or gynecological checks or whatever other checks they recommend for that age. So it's cdc.gov. Prioritizing, and this is something we can do every day, a good colorful diet, trying to achieve the recommended exercise and physical activity, which is actually, it's 150 minutes per week. And that's a lot, right? Like 150 minutes of moderate intensity physical activity and exercise per week is pretty overwhelming. But what the research is suggesting, that regardless of your ability levels, even a slight improvement or a slight increase in your current level of physical activity and exercise can have a positive effect on overall quality of life. So even if you never in your wildest dreams will achieve that 150-minute mark, achieving 10-minute mark might be still having positive changes on your overall health. So keep that in mind. And also with exercise too, remember, it doesn't have to be completed all at one time. It can be completed intermittently through the day. Maybe you tack it on with other activities that you're already doing. So for example, everybody's going to go to the bathroom 6 to 8 times a day. Maybe after you go to the bathroom and you wash your hands, you do some squats at the sink. Maybe while you're waiting in the morning for your coffee to be brewing, you stretch your calf muscles, or you do some wall push-ups. Trying to figure out different ways to engage in more physical activity through the day can help your overall health. Sleep. We could do a whole workshop, and we have done a whole webinar about sleep. So I would encourage you all to go ahead and watch that. But it's important to observe good sleep hygiene. And if you feel like you're not sleeping well, we need to figure out why it is. If it's spasticity, if it's related to your bladder, if it's related to your snoring spouse, whatever the case might be, figure out what's interfering with your sleep and try to figure out a way to improve that. Problem solving, we've talked a lot about adaptation. So again, adapting, preparing, planning, making sure that what you need to do, you're able to do based on your abilities, and engage those professionals. Again, I think Megan's right. We could have the whole team listed in this. The key message here is if you're having a struggle, tell somebody, and another member of the team can help to connect you.
So medical management, as Mandy already said, includes seeing your primary care provider for regular checkups. And so the website that you gave is excellent, and I'd encourage people to check that regularly, because I just got an email, for example, that a new screening recommendation has come up. Yes, because they see their neurologist most often, and because sometimes when you call your primary care doctor with a problem, they say, oh, that's MS, call your neurologist. People sometimes tend to think that they don't need a primary care doctor, and you absolutely do need a primary care doctor. I guarantee you that your neurologist, your NP, your PA are not necessarily keeping up with the latest screening recommendations for colonoscopies, pap smears, and mammograms. Taking disease-modifying therapy as prescribed is also an important way to reduce the risk of disability progression. We know from research that the earlier you take disease-modifying therapy in MS, the better off you are, or the better outcome you're likely to have. And then having regular discussions with your MS provider about whether or not your DMT is appropriate for you. And by that we mean if you're having relapses and you're still on the same medication, why? If you're having MRI changes and you're still on the same medication, why? If you're having disability progression and you're still on the same medication, why? Because we now have a very large armamentarium of medications with different mechanisms of action with which to treat relapsing forms of MS. And also, we now have medications to treat progressive, secondary progressive, and primary progressive forms of MS. Some people will say, well, I don't want to try the new thing, or I'm afraid of some of these other medications. But it's important to consider what potentially the worst outcome could be, which is that your MS gets worse. And that was your first greatest fear. Definitely following directions to take care of other medical issues rather than ignoring them. And this includes taking responsibility for things like blood pressure checkups, diabetes, cholesterol, and sleep management, as well as, like I said earlier, mental health care. Other thoughts in progression preparations: avoid avoidance. And so, you know, the elephant in the room is the one we tend to dance around the best, but we really need to address the elephant in the room. So have open and honest and regular conversations with your support team about your symptoms, and ask them if they've noticed any changes in you that you may not have noticed. Talk to a financial planner, and I would do this sooner rather than later. You know, I don't think coming out of college is too early to talk to a financial planner. I certainly wish I had, and I don't have MS. So I think that, you know, that's just a proactive thing to do, as is maintaining advanced directives, creating a will, naming a healthcare surrogate. These are just grown-up things that you should do. And if you are, you know, in pre-middle, middle, or older age and you haven't done them yet, you should have done them even if you didn't have MS. So think of it that way. You know, they're uncomfortable pretty much for everyone, but they're really great ways to just take some of that extra worry off your back. I always talk to people about having FMLA paperwork filled out for you and also for your support partner that you would count on in the case of disability before you need them. Because the last thing that you want to do during a relapse is worry about whether or not your healthcare provider is going to get your paperwork in on time so that you can get paid if you're still employed, or so that your support partner can get paid if they're still employed. Relapse time is crunch time. So get that stuff filled out, and hopefully you won't ever have to use it. But if you do, it's one less thing to worry about when you're faced with challenges. And then create a plan for bad days and write it down. Who can you call on if your primary support partner isn't available? Who's your backup? What's your backup plan for transportation? Would you need childcare? You know, if you need help with preparing meals or with errands, who could you call on in addition to your primary support partner? And write it down, like I said, keep it in a safe place, and make sure that the team, your team, knows where to find it, so that you just don't have to worry about those things anymore because you already have a plan. So this is a blank slide of the can do to do that will be available to you within this presentation. And you can even write down the 5 Ps now as you're looking at them. So I would encourage you guys to do this and make copies of it, and use this can do to do sheet as a way to make a plan and put your worry away. You know, this is the point of talking about all of these things. It's not to, you know, bring people down. It's to give you guys tools to use to just take some of your worry off the table.
And we'll leave you with a final thought by an excellent family therapist. And it's: find a place for the illness, but keep the illness in its place. In other words, acknowledge the disease and manage it, but try your best not to let it manage you. And hopefully this can do to do and the 5 Ps will give you a template to kind of start managing all of that. We wish you all well. Thank you for your time, and we'll move on to question and answers.
Hello. Thank you guys for some great information. That was a lot of information, but you did it in a clear and concise manner, so thank you for that. We don't have a tremendous amount of time left for questions and answers, but we did get a lot of questions about how do I find this specialist? How do I find that specialist? And I know you guys touched on it, but can you give the audience just how do you find specialists like a physiatrist that you talked about? or a mental health professional that specializes in MS? What would you recommend?
So I can take that one. So your local chapter of the National MS Society will keep a list of providers who are interested or have special training in multiple sclerosis, as well as people who are partners in care with the National MS Society. So that's the first place that I would start. Otherwise, I would simply ask your neurologist, your primary care provider, and even friends for recommendations, particularly when it comes to mental health providers. Oftentimes, if you open up your insurance booklet, it's just daunting. And so I would ask for some recommendations.
Great. Thanks, Megan. Did you want to add anything, Mandy?
I was just going to add the American Physical Therapy Association, as well as the American Occupational Therapy Association. I'm sure there are similar associations with other disciplines that you could search for a provider with a particular specialty. Those could be found online as well.
Great. I do have another question, Megan, for you. We get this question quite often, and it's simply, how do we know when some of these symptoms are related to age and or MS?
Yeah, that's a really great question, Laura. As we all get older, we notice changes in the way we think. We notice changes in our level of energy. We notice changes in our balance. And really the best way to know what it's related to is to address it with your MS provider, and do that with annual MRI surveillance. So changes in the brain that are related to aging or vascular disease look fairly different than changes in the brain related to MS. We can't always see disability progression on a brain MRI. We're just not good enough at that yet. But I think if you have a fairly good timeline of the way things have occurred for you, and you have a series of surveillance MRIs to look at, again, keeping in mind your age and other medical conditions, it can be, not super easy, but fairly easy to tease out what's age-related and what's MS-related. The good news is, from the standpoint of a person living with MS, the things you can do for yourself, like following a healthy diet, exercise, practicing self-care, practicing good sleep hygiene, maintaining control of stress, will help with both age-related changes and MS-related changes.
Great. Thanks, Megan. Mandy, can we close on a note? I know you mentioned one of our neurologist's favorite sayings, and I think it can be repeated many, many times. Can you go over that one more time for us?
Right. I have to give credit where credit is due, though. Randy Shapiro, he's a neurologist. He's with Can Do MS. He always says the key to overcoming disability is mobility. So finding a creative way to stay active, continue enjoying your life, even if it's different than how you did before.
Yeah.
It's a smart man.
Well, thank you both for some great information this evening. Thank you so much, Megan and Mandy.
Thanks, Laura.
And as we close, I would like to go over some of the resources that are available from Can Do MS. We do have additional resources that you might find helpful. On our website, you will find archived webinars, e-news, library articles, and Can Do On Demand. You can also submit a question to the Ask the Can Do team, which will be answered by our team of MS experts. I would also like to highlight some of the resources available from the National MS Society. They have a variety of brochures and video segments that can be accessed on their website, nationalmssociety.org. You can also contact an MS Navigator at 1-800-FIGHT-MS. If you did find this webinar valuable, please consider donating to Can Do MS or the National MS Society. We do have a number of people that ask how they can get involved with Can Do MS. We do have a campaign that's available. It's called Kick MS. You can ask for donations instead of gifts, or you can have a bake sale or a walk or run in a 5K. Anything goes when it comes to kicking MS. Another great resource that we have available to you is MS Path to Care. I would encourage you to go to the website mspath2care.com and learn about the importance of shared decision making in MS care. I would like to tell you about our next webinar in the webinar series. It is going to be on children with MS. It will be on August 13th at the same time. And again, you can register free of charge. Finally, for those participating in our webinar series tonight, I would ask that you complete the survey that will show up on your screen as soon as we conclude the webinar. So I want to again thank Megan and Mandy. And most of all, I want to thank you for participating in tonight's webinar. We really appreciate you joining us and spending your valuable time with us. And with that, I would like to say thank you and have a great evening.